All right, so like I said, just the housekeeping items. If you are on the call, please make sure you mute if you are not speaking. Hold questions and discussions till the end, and unless, of course, the speaker does ask for those feedback. You can always use the chat box to put your questions in along the way so you don't forget. If you're like me, you might forget before the end of the webinar, and we will go ahead and moderate those at the end. Just a brief overview of the agenda for today. We'll have 4 state partnership teams presenting on their current activities, what lessons they've learned, and provide some very valuable feedback for you all. And that'll be moderated by our very own Dr. Arbach. And then we will conclude with some questions and just an open discussion of what you have learned and challenges and opportunities moving forward. So the learning objectives for today is to discuss success, barriers, and lessons learned from November's recruitment efforts, and then, of course, be able to present your first PDSA cycle, highlighting a timeline which includes your dates and results thus far. And I know we are all very much looking forward to hearing all of the great discussion that we'll have today. All right, so that being said, we'll go ahead and turn it over to our 4 states. Just a reminder, again, if you're not speaking, put your phone on mute. We're still getting some background noises, some beeping and whatnot, so just being respectful to those speakers. And I'll go ahead and turn it over to Kentucky, and I will be moderating, so when you want the slide advanced, just please let me know. Thank you.
And Cassie, just to chime in, this is Mark Auerbach. Thank you, everyone, so much for joining. The concept of this is really to be interactive. So I think if you can hold questions verbally, but put them in the chat box, not thinking about that as an option, but actually let's use that as a process. So if you have a question or comment, get that in the chat box as the talk is going, and then we really want to have an interactive discussion in the second half. And I want to echo Cassidy's appreciation. Thank you so much for the 4 states that are willing to share some of their stories and opportunities for improvement as well as successes. Thank you, Kentucky, for going first.
Thank you, everybody. This is Morgan. Just to preface, I have to apologize. I will not be on the full call today. I have to leave due to another commitment. So if you have any pressing questions, get them in the chat box, and I'll try to get them before I leave. And I'd be happy to follow up with anyone tomorrow. So to go ahead and talk about what we've done here so far, starting with our beginning benchmark, the 2017 survey gave us 35 of our 165 agencies that we surveyed claimed to have a PEC. 8 had a plan. 57 were interested, and 65 at the time said they had no PEC and did not indicate any other plan or interest. And we've had another department become licensed since that time, so they fell into the no PEC category initially. Kentucky has a regional structure that is used much more by the fire service and the healthcare coalition programs, and we haven't used it a lot in EMS, but I wanted to look to that structure as a base for the work we were going to do here. So we have 4 sort of larger regions that are made up of smaller districts that are numbered, and then I used the data from the EMS survey from NEDARC to overlay the spread of our agencies and whether they did or didn't have a PEC over that map to get a feel for where we were starting. Next slide. We also had planned initially to have 1 representative, myself being one, from those larger regions and fill in with 12 other PECs representing each of those other districts that weren't already represented to be part of our sort of state working team. And some of the initial barriers we hit fairly quickly were that we had a very uneven response to asking them to apply for those positions, in that we had multiple applicants from some districts and none from some of the others. So to kind of manage that uneven response, we did some targeted recruitment in reaching out to specific agencies that we knew had the capabilities to join the project and do some work for us, that we thought we could get on board with just a little nudging, as well as in some cases we sort of stretched the boundaries of those districts a little bit. So Region 6, we had 4 or 5 applicants and none from Region 5, so we were able to take someone on the border of 6 and ask them to do some outreach efforts for us in that neighboring region. A larger region we have actually split because we were not able to get those commitments to do the larger work as easily. We filled those positions with staff within the EMSC program, as well as one PEC representative from an agency. Chad is on the call today as well and has joined us. And so that opened up some spots to have a larger number of people on the state team than we originally planned. So again, we had planned for 4 plus 12 to be 16, and in the end, we have 2 people from the EMSC program, myself and Dr. Fallett, and Chad representing an agency PEC that has joined us on these calls and will join us in Austin for our work there. We did have some delays in getting some memorandums of agreement that we're going to sign with these agencies through our legal process, but that has finally gotten approval, and I will be getting those out to the agencies here very shortly. And then, of course, the barrier we're probably all running into is just time. The EMSC program has a progress report due here next week, and so with that and other projects that we have going on, having the time to devote to this project is the biggest challenge. Next slide. So we had kind of planned to have sort of a layer of teams. So we have the Kentucky Board of EMS and the EMSC program. Dr. Fallett, myself, and Chad Wheat being the primary learning team that is engaging in these webinars and meetings. And then our larger project team, state project team now, is going to have 17 PECs that are geographically distributed reasonably well across the 15 regions. And the services that make up that group, 12 of them are county-based EMS agencies, which is the predominant category here in Kentucky. We have 1 hospital-based service, 3 private services, although all 3 do perform 911 response within a given area through some sort of contractor agreement with the municipalities, and 1 fire-based service. Next slide. We've also done some email outreach to the agencies. So I split my agencies into 4 groups, those that had a PEC currently according to the survey, those that had a plan, those that were interested, and those that just said no. And I crafted a separate email for each one of those. And I sent the fast fact sheet that was developed for each state and attached that. And this is the email basically that went out to the surveys that currently claim to have a PEC, kind of highlighting that they are the ones that answered the survey, reminding them that we have a title for this position, even if it's not something they normally think of by that term, gave them the overview information, and really tried to push with the agency directors that this, by sharing this information with me and letting me know who this person is, that I might be able to take some plates off or some things off of their plate and reach out to that individual directly, and then they can bring the director in the loop on things as needed. And it gives me that primary point of contact with each service. And then I changed the language up for the other 3 groups depending on which category they fell in, just slightly, but the bulk of the email was the same. Next slide. So I've been tracking progress, and I'm a fan of spreadsheets, and I like to color code, although I have to create a little reference chart for myself so I remember what all those colors mean. But I created a spreadsheet, again, using data out of Tableau from the EMSC survey that was done in 2017. And then I can filter now by which group started off as saying they had a PEC and then what they have responded to. So we had a EMS pediatric recognition program that we initiated after the survey, but prior to the start of this collaborative. And we actually gained 7, we either confirmed 3 that were already existing and added 4 more through participation in that project. In developing our state project team for this collaborative, we've added 16 that were confirmed to from the original group and added 14 more. It's interesting to note that we've had as much, if not more, success with the agencies that answered no originally as we have with those that had indicated interest. And then most of the groups have had a first and second email. The NOPEC has only had one email so far, and those are the numbers there on the chart you can see as to who's responded. And so we have confirmed 16 of that original 35, and we've added 25 additional PECs, so our total right now is 41. And so that's some improvement, but of course we've got a long way still to go. Our target group is to get to 83 PECs for within the state. Next slide. We did add a designation within our licensing system. So when I pull up an agency roster within the licensing system, I can designate who the PEC coordinator is for that agency. And they cannot do that themselves currently. That may be a functionality that's added in the future, but all they have to do is contact someone in our office, and we can log in and make that designation. And so the top part of the screen here you see, and I've used Chad's agency as an example. He is designated as the PEC for that service. And then below that is the report that I can pull. And I literally, with just 2 or 3 mouse clicks, can pull a current contact list for the PEC coordinators in all agencies that have designated one. Next slide. And kind of wrap up, and then I'll get to 1 or 2 questions that I see. Our state project team is really just starting to amp up. We are going to get those MOUs or MOAs out shortly. Our first online meeting will be January 16th through the GoToMeeting platform. And I will be giving an overview of the project and the background and the PEC and why it is important and kind of what we hope to accomplish with this project. We'll give those state or regional district representatives some assignments as far as outreach. We're going to take the contact list for the state and divide that up for each of them to have a short list of people to get a hold of and try and encourage them to participate. And then we'll be planning for individual meetings within each district over the course of this next number of months. Some of them will probably carry over into the summer, but we'd like to do just small district meetings with the PECs in those areas. We have some staff here in our office that do licensing inspections on a yearly basis, and so we'll be prepping them to do a little outreach during the annual inspection process and encouraging those agencies to designate a PEC. And then we are also looking at beyond the state team meetings that we'll have is that we begin an actual meeting both in person and online with PECs across the state. And right now I'm planning a 2-hour block that will hit prior to our EMSC committee meeting every other month. And we'll be able to provide maybe some in-depth or slightly more advanced clinical education, some instructor methodology, especially looking at skill competency testing and things like that, giving the PECs some training and education on how they might go about doing that, as well as allowing for real peer-to-peer exchange of, sorry for the typo there, allow them to talk to each other about challenges and barriers and things that they have put together, systems that they have developed, and use that time to let them share directly with each other and hopefully take some of the burden off individuals. That was my last slide. As far as the MOA, or MOU, it's a memorandum of agreement, and we use that process to partner with other agencies or individuals that do work within the grant that are not employees of our service, particularly if there's an exchange of funds for that work or that grant participation. And so our approach to this project included using some of the funds that we received for the collaborative work to actually reimburse the agency for this person's time. And we're committing them to the project for 1 year. So essentially, they're going to be involved for all of 2019 in our outreach efforts to increase the number of PECs. I can share a copy of that for anyone that would like to have it. So we've got kind of a template version. And this allows us to provide some funds to those agencies that kind of sweetens the pot, or it's a carrot for their participation. Let's see, what else did you have on here? Why have I had more success with agencies that indicated no? I don't know for sure. My gut feeling is that whoever took the survey last year is either maybe a different person than was this year, or I don't know how seriously they take some of the questions sometimes on surveys, but I feel like I have a pretty good relationship with most agencies in our state, and have the time that's gone into developing those contacts has done a lot as far as gaining participation in these projects. But I do think I'm more surprised that for the 35 that said they have a PEC, I've had slower response from them. And maybe in part that's something other people might run into, is those that said they had a PEC, maybe they do, maybe they don't. So I'm interested to see how that continues to progress. And so that's all I had prepared for today. I see Chad answered the question. We do use ImageTrend for data collection and our licensing tracking as well.
No, that's fantastic, Morgan. I think overwhelmingly people are extremely impressed with the work you guys are doing. Is there any other questions, or Mark, do you have anything that you want to follow up with?
So I guess my jaw is on the floor right now. So I just want
all of ours are.
Yeah, I want to level set a little bit for the team. So this is fantastic work by Morgan and Mary and others on their team, sort of knocking it out of the park. Every culture, every state, every group is a bit different, and the journey where we're starting, where we're ending up is going to vary. So it's really great to have some aspirational goals to be like Kentucky, but I don't know if many or any of us are going to be able to do that. So I do want to level set to make sure people recognize that this is not the journey that we all need to take. It's an example of, I think, a really amazing, very successful journey that we can learn a lot from. So I want to congratulate the team on the presentation, on their work, but I really do want to highlight that other groups and teams may have a very different journey, a different starting point, and definitely a different ending point. So the benefit of the collaborative is by learning from each other's successes, as we heard now, as well as each other's challenges and failures. So I also want to highlight that some of the teams that are presenting today have slides. I think when it's a very evolved team like Morgan was, the slides were really helpful and sort of, again, set the bar very high and give an example of the model of what we're trying to discuss. But some of the other teams today, as well as going forward, do not need to have slides, and it's not necessary. I think that the goal really for many of our other teams will be to discuss some of those challenges and get some feedback. So I hope that we can all see this as a celebration of one of our site's successes, as opposed to seeing it as a bar that we all need to hit. Does that ring true with other states as well? I mean, maybe everyone is knocking it out of the park and I'm just going to be blown away by all the presentations, but this was really outstanding.
Oh, and it does appear that we do have another question. Was the MOU model an easier, quicker way for you to expend funds? And that would be from Sarah O'Donnell.
Yeah, I mean, that was part of it. When we looked at having 6 months to go from start to at least obligating all of our funds, that was going to be a real challenge for us. Our process just would not have allowed me to bring on personnel new to the project that we were paying on a part-time basis. It would have taken us the better part of the 6 months, if not longer, to do that. So that was not an option. Because we used the MOU model for a couple of other things, it was something we're already familiar with that I knew I could pull off in that amount of time. And even just spending the money on other things would have been nice, but the limits to the project time-wise was going to make that hard, as well as I just knew it was going to be much easier to engage services if there was a nice inducement to do that. And in some cases, some of those agencies have already committed to sort of volunteering that person's time and using the money to purchase something related to pediatric care, whether it's equipment or training, which is kind of ideal in my mind. And others may actually use it to cover personnel costs in exchange for the work on the project. But we left that up to them so that they had some flexibility in how to approach that.
Oh, fantastic. Thank you. And Sarah said, what a wonderful way to address that challenge. All right. So I believe our next state and our next team will come from Wisconsin. And like Mark said, slides are not an issue. So if you don't have slides, feel free to just make it conversational. I think that was the intent when Sam reached out to you guys. So that is more than fine. The only thing I did was put your, what do you call them, pulse checks or snapshots that you guys do. I just put a little blurb up so we can all have a visual. I'm a very visual person. So with that being said, I'll turn that over to Wisconsin.
Hi, everybody. This is Jason Swichka from Wisconsin. Can everybody hear me okay?
Yes, we can.
Perfect. Yeah, wow. To follow up Kentucky, that was it's going to be a hard act to follow here. But it was awesome because I'm relatively new. I just started this year in the beginning of November, so we're just getting rolling here. A little bit about Wisconsin is we're got a lot of agencies, a lot of volunteers, so we have 70 agencies. When we did the survey, there was 760 licensed EMS agencies in the state of Wisconsin. The random sample was 406. Out of that, we found that, as it shows up there, 70 EMS agencies that have expressed an interest in adding a PEC. Following up with them, we have 62 that said they really are interested, and then 8 of them said, we want to see more about it. So we actually got 62 that are more interested in adding a PEC. So our goal is to recruit 36 out of them by the end of March to add a PEC. So some of our barriers in this is not every service is the same. We have a number of volunteer services and a number of paid on call, and then we have our career services. And most of our volunteer services, you have one person doing 5 different jobs already. But some of the success on that conversations are that it's a engagement issue. They really want to be able to take care of pediatric patients better, so it's a hot topic right now. With the volunteer contingency, there's a number of people that want education. So we've been starting this about 2 years ago with EMSC. We've gone around to different services and we do trainings such as airway management, seizures, child abuse. So we've already started to talk before we actually got into this project, so that helps us with making them contacts previously. Other barriers is also the changes in service personnel status with having volunteers changing. They get a different job, they get moved on, injuries, a change in leadership. The chiefs change. Some of them change every year up here. Some of them change every 2 years. Now I'm talking about the volunteer services. And so that's a little bit of barrier. I know it was asked when we go out and contact these people what a big barrier is that email addresses change. We have a lot of chiefs and leadership that have so many emails coming in, it's hard to get to that. So without being in their spam box, there's a lot of follow-up phone calls that we need to do. And having that initial contact with going out and doing these EMSC learnings already helps to do that. So right now I got 20 services that out of the 36 that definitely are interested. They want to get going on this. So we formulated our PEC team, our Wisconsin team, which is including our PEC program manager, which is myself. We have an EMS provider with a PEC already, and that's from up in the Marinette area. And then we have another EMS provider with a PEC down in the Milwaukee area. So we're reaching kind of our paid on call career and volunteer area up in Marinette that has a lot of services up there, and then our Milwaukee area that has a ton of services there. So then we go to some with EMS provider. We have 2 EMS providers without PECs on the team, and we're looking at, we have one in the central part of the state that's very rural, and then we have another one up in the western side of the state from Barron. We have identified our state DHS EMS representative, and so we have our state office on board helping us. From our EMS for children, we do have Dr. Michael Kim and Dr. Lauren Brown that are our medical co-chairs that are very active in this. And then we have our family rep from the emergency EMSC, and then our project manager, Erica Kane from EMSC, and then a hospital rep. So we've got our 12-person team, and we're going to start meeting. We're going to do a phone meeting next week and start looking at our plan and drilling that down. I'm interested in that MOU that Kentucky was talking about, because we're looking at how to get, it down on paper and what their feedback's going to be to us, what their responsibilities are, and tell them what they need to do. Sorry, I looked at something else here. With that, we looked at how can we supplement these services with a carrot, per se, on coming on board with our PECs. And instead of purchasing a kit or a piece of equipment that doesn't fit every department, we are going through a application process where when they commit to be on the PEC team, they will give what they need. Some people need a pediatric jump bag. Some people need Brasilo tape. Some people need other specific equipment. So they'll be applying for that, and that'll give us kind of a feel of what the equipment needs are, and then maybe we can base training off of that for the state. Going back to the people with the PECs, when I'm contacting these people with PECs, some have no idea what PEC meant. When they did the survey, they found that when I asked who your PEC coordinator was, a lot of the service directors thought, well, I'm in charge of that, so I must be the PEC coordinator. So we had a number of PECs that have not done anything with this yet. There's 66 of them that stated they did. So kind of our dovetail off of that is to bring them on board with a big state meeting and kind of bring them right along with the people that don't have PECs, so we can get them on the ground working too. So our plan is at the infancy stage. We do want to have our job description, job requirements out there. Going back, I started my spreadsheet working with contacting people, and I'm getting a number of, primarily it's email contacts going straight off the survey. So we're getting a number of them coming back because, again, the email address isn't working. There's been some changes, so that's a manual phone call on them. When we separate our state up, we are going to use our RTAC regions. We have 7 regions in the state of Wisconsin that we're going to work through our RTAC. And actually, looking at some of the history in the RTACs, there was supposed to be committees with pediatric involvement on there. So I'm working with my fellow colleagues in the RTACs now to find out how we get into these RTACs and start having meetings and identifying kind of a central hub for these to have, the 4 meetings a year where the PEC coordinators can come in and have some meeting time also. So, and demographics is another barrier with the size of the state and the volunteer contingency. So, getting together with people during the day doesn't work for a lot of our volunteer services because most have primary jobs. So we got to get a little creative on that, and that's a work in progress right now. Looking at correct meeting times, there's going to be some night conversations that need to be had, and then there's the day conversations. So I will go to some of the questions here.
Can you see them there? If not, I could scroll through them. So there was a question about sharing a copy of your job description and more detail on that in terms of formalized expectations for the PEC, like number of hours and training.
Absolutely. After our meeting next week, because I want the committee to kind of go through it and dot the i's, cross the t's. I will definitely share that when we get that. And then the formalized expectations written for these PECs. That is what we need to discuss as a team also. What we want to do for training. We looked at what else is a benefit to saying that they're part of the PEC. And our EMSC website has a spot on there where we can have a sign-in and have added education. We are looking at doing video education that can be done on a person's personal time. We're working on our first section of that right now, the respiratory section, and that will be set up here very soon. So to answer your question, Tammy, I don't have them formalized expectations written down yet for the PECs.
I have a follow-up question to that briefly. This is Mark. So in terms of those modules, is that something you're creating and might be willing to share, or is it using pre-existing modules like PEP or something of that nature?
We are creating them right now within our EMSC team, and yes, we'll definitely share them.
Excellent. Sarah O'Donnell had a question. Can you say more about the value of having agencies without PECs involved on your team?
Yeah, so why we looked at bringing them without the PECs on is to kind of get that fresh eyes on what they're needing for pediatric education and care, and looking at the data. So having them as kind of having the wish list, that they're looking at it and they can say, yep, this would be able to be implemented in our department. This wouldn't be. This is where we've been having our challenges. And also to have the people with the PECs on the team that are working with it, to have that conversation, that real-time conversation between the two EMS providers right around the table to bring forth our working plan. Did that answer your question on Sarah?
It looks like you did. She said that's a fantastic idea, very valuable. And I think that was the list of questions. So thank you so much. If anyone else has any other questions, please write them in the chat box or verbalize them.
Thank you.
Thank you so much for sharing. And I think while the journey is different, I think there's a lot of lessons learned, and it seems to me just the pulse checks. This is more of the journey that many of the other states are on. So we really appreciate some of the lessons learned and some of the things that you're doing. And I think these opportunities, by being in a collaborative to share those resources or even potentially create them together, is something that's coming down the pipeline. But really great job. A lot of work since starting in November, and it's hard to believe that you've only been on the job a couple months.
Thank you. Yeah, thank you very much.
Yes, thank you so much. I think that moves us on to Connecticut, but we had a quick chat, and with timing issues, since we are kind of running low on time, they asked if we could move their presentation until next month. So while we thank Connecticut for volunteering today, we're going to go ahead and move you to the January pulse check, and we will go ahead and move to New Mexico. You might still be on mute.
Can you hear me?
Yes, we can.
Oh, sorry.
Welcome.
When I thought I was on mute, I really wasn't on mute. I apologize.
No
My
worries.
update is going to be fairly brief. We just had a little check-in last week, so I did some bullet points for that, and I'll just kind of go over some of the same things that other people are experiencing, either successes or barriers. But we are moving forward with presenting the PEC concept, the PEC initiative, the ideas behind the collaborative, and why it's important to have a PEC. We've presented at 3 conferences to our group of pediatric EM specialists at the Level 1 Trauma Center, to our trauma advisory councils, 3 of those, and the statewide EMS advisory committee, and the trauma advisory system. So they've all been extremely supportive. We've been able, through those meetings, to get footholds in our New Mexico Hospital Association, which has been difficult in the past, but there are several members of that association that think it would be important to bring to their attention, so that was helpful. We are still recruiting, and I think it's important that I find from our 3 EMS regions specific champions. I have 2 regions that are covered. I need 1 more from our metropolitan region, and you would think that would be easy, but that's actually the hardest one to get people to volunteer from, because they think they're busier than the rest of our rural communities, but whatever. They're really good people, but we're going to try and rein them in for some support as well. And we are working to solidify. I was supposed to do what we call a web talk next week, but unfortunately, due to some additional conflicts, we will not be doing a web talk on the pediatric emergency care coordinator position this month, but we will move that to January. And then from that, we're hoping to kind of make a little 2-minute infomercial that we're going to send out through the regions on pediatric emergency care coordinator. That was something that NEDARC had kind of touched base on a couple of years ago with some other things, so we're going to try and use that to get some quick snippets out to the regions. We have 59 EMS surveys that we received back, and out of those 59, we have 32 potential focus group participants. I'm going to narrow that down a little bit because, that's an expensive focus group to hold and offer travel to, but we will be doing incentives to get those people to participate. And as it turns out, it is a fairly equal number. If I go back and look at their agency, if they participated in the program, it is an equal number of has PECs, interested in PECs. It's almost fairly equal. So that worked out well for me. In the follow-up has PEC category, we have 11 responses. We're still having trouble getting people to respond to the email, so we'll have to start making our calls that have confirmed that they do, in fact, have PEC. And in the no PEC category, there were people that I just happen to know that finished those surveys, and when we see them in person and we're having these conversations, they're like, oh, yeah, we actually could have answered that differently if we'd have known this is what you guys were talking about. And I was like, perfect. So I already see an improvement in our numbers, even though I haven't formally been able to track them. We are completing that database, and we will be entering that in the next couple of weeks before we go on break. The barriers are pretty much the same. There's just not enough time, and only me doing the travel and then coming back and bringing disseminating the work to our team members here. But also with our service EMS providers working different shifts and the availability, getting them to be able to respond back when I'm in the office. It is a little difficult. Coordinating internal processes for getting things approved and getting things paid to people who have agreed to be our regional champions. That's taking a little longer because we are a university and it's full of red tape. And just internal barriers with staffing issues and this being CE time for renewals. Those are things that we're working through, but we still think we're on target. I think that the PEC has been really well received, and people are excited that we're making it kind of a little competition. We're going to put that in with some facility recognition components, and we're going to try and and make it a friendly competition among our services and our hospitals to have PECs and become recognized. As far as when we were looking at the Plan, Do, Study Act, we really have been on target with all the things that we said we were going to do, and our results are coming back in a positive light. And that's really all I have for today. I wasn't sure exactly what we were supposed to talk about.
No, thank you, New Mexico. That was great.
It was really fantastic, and I think there's some great ideas that were brought up, and it's really neat to see the diverse approaches. There's some overlap. So there was a question about, I'm trying to go backwards here, so I'll start with the last one first. So how's it going with the intern? Any other ideas for getting help that either New Mexico or other team members have in terms of human resources?
So the intern is a great idea, but remember they're working for free, and they have a life outside of here, so it's been very difficult giving up the responsibility to somebody who may not be as responsible as I had hoped. But that being said, she is in the field. She's an EMS provider, so she has actually made momentum with some of her community EMS providers to get them on board with PEC, so that was good. I think I am going to steer towards adding more key staff members to help me with this, to a part-time FTE on the collaboration, so that funding is going to be very helpful in that area. What was the other part of the question?
Oh, so I think I just opened it up to the rest of the group if individuals had ideas about how to get additional staff or resources. Certainly, I think an intern and an EMS provider is a great idea, and I would echo your experience that your expectations have to be pretty reasonable. Is it possible to provide a stipend for your intern? Was the follow-up from Terry. So whether that's an intern or I guess a student or something of that nature.
I was actually going to look into that. So for this particular intern, she is using this as her graduation requirements for her undergraduate degree. And as soon as she's fulfilled that obligation, I'm going to see if it's possible to add her to some type of financial component that's associated with like we do our EMS volunteers. It would be difficult to hire her on as a staff at this point, but she's really very, very good when she's able to participate in this. The other thing that we are utilizing are some of our instructor candidates who are going to be helping as when they're going in front of their committees. They're going to be talking about this initiative. And putting the PEC idea into our future instructors, I think is going to be helpful, and making sure that it's in the back of their mind, so they're going to be talking about it as well and looking for those people in their networks.
And when you're referring to instructors, is that paramedic and EMT courses, or what group of instructors?
These are intermediate and paramedic instructors.
Excellent. Another question, thank you for that answer, was would you be able to share your pre-survey of the focus group?
Oh, absolutely.
Okay. I'm just, again, trying to go backwards in line here. There's a lot of wonderful questions, so let me see if I can get back to some of the other ones here. I had a question while I'm looking through. Can you just comment more on the webcast or what the attendance has been at those and what platform you're using?
So we use the Zoom platform, and attendance is kind of hit and miss. We've had as many as 50 participants, and the way we did that one in particular is we worked with 3 EMS services in particular. We found a topic that they were asking about at a conference, and then we coordinated that topic with those services, and they had their staff meeting. So each service had 7 to 11 people in attendance, so we were able to get a roster, and they were able to present it all at once as part of their staff meeting. Otherwise, it's usually anywhere from 10 to 20 people, which still isn't bad. We hold it during the week, and it's in the evening so that it reaches some of those rural people who are working during the day and then can get their CE in the evening. the webcast that I'm hoping for this one, though, is my EMS regions have promised to really push it out so that we can increase attendance. So we're hoping for better attendance when it comes to that particular webcast.
Excellent. So there was another comment. Has anyone ever used AmeriCorps or other volunteer type of entities for their EMSC projects at the state level? This may be AmeriCorps, it may be other type of volunteer services, it might be a school or a group of students, but just a brainstorm either in the chat box or out loud. Do other people have pools of individuals that they can think of? I think AmeriCorps is a regional one.
I'm sorry, I had a little cutout. Was there a question directed to me? My speaker cut out.
I think the question was directed to the larger group.
Okay.
What other pools other than students? And I apologize if I cut out. So someone, Victoria, had brought up AmeriCorps. Are there other groups that we could or should look out to that this might be a volunteer experience for them that would be mutually beneficial? The one that comes to my mind would just be students needing a thesis project, whether it's undergraduate or master's type of students. I'm not sure if paramedic or programs require anything like that, but certainly for some type of thesis would work. And then the additional piece that I think Victoria is mentioning is really more just purely service oriented. So I'll take the silence as not people not having other groups. Certainly we could share those up. Someone mentioned, Sarah mentioned public health students and master's programs that need a culminating experience in terms of improving access to care and this type of project. Thank you, Sarah. So thank you so much to New Mexico. Again, a little bit of a different journey, really amazing use of multiple types of technology and communication strategies by your group, as well as the different teams so far. I do want to give a shout out to NEDARC. I forget the name of the exact platform, but it's this Adobe sort of short movie infomercial platform that NEDARC is really helpful at coaching me through that, and they did that for the National Pediatric Readiness the Facility Recognition Project, I'm sorry. So feel free if you want more information on that to reach out to us, and we look forward to seeing New Mexico's, and maybe we can mirror that. So if you haven't registered for the conference in Austin, please go ahead and do that. If you have any questions, send them along to our group, to Terry, Sam, myself, Cassidy. And I think we'll enter this last phase where ideally we'd like to hear from the team any additional questions within the last 10 minutes or so, or comments, and open up the sort of line here beyond the chat box. And I'd ask just more of a round table that each state mentions a take-home point from today's session, whether that's 1, 2, or 3. Remember, the objectives for today were I'm trying to see if I could find them to just. Cassie, did you have them there? Can you state the objectives just so we can remind people of what they were?
Certainly. And, there we go.
All right. So I hope we achieved these objectives today. Certainly, I feel we heard successes, barriers, and lessons learned from some of our groups to date, and heard the PDSI cycle adapted really one cycle through. So I guess, Cassidy, if you want to go team by team, and if we can just hear sort of some lessons or take-home points and or discussion points, I think that this is sort of the last phase here. I think we did hit a lot of our goals for the interactive discussion within the chat box, so thank you.
Let me pull up the team list. My apologies. All right, so how...
First. So Connecticut, you can go first while pulling that up. Vicki, if you want to go first, thanks.
Sure. I think the biggest takeaway is just remembering that this is a brand new concept, not only really for us, but for EMS as well. So just staying as flexible as we can and trying to balance, getting our missions done without scaring people away.
Fantastic. How about New York?
Well, I think we're going in the same directions as most people, and our state is very big, so that is something that we've come on the challenge. It was nice to hear that other people found that some people claimed to have a PEC, and they really don't necessarily do, because we are finding that to be one of our issues is they said they had a PEC, but when we start looking at it, they may have one of the requirements, but, we believe that they need to have more than just one.
Great. And Rhode Island.
Hi, everyone. So this is great to see what everyone else is doing. Can you guys hear me?
Yes.
Okay. I just wanted to give a brief update. At our last call in November, I was doing the recruitment for a possible meeting with the PECs, and I wanted to let everyone know we actually had, our goal was 40 people to join the PEC intro training for our certification process. We actually only had 33 that showed up, but, we thought it was a huge success. And out of the 33, about 30 committed to going through the whole certification process. And so we're hoping, the other thing that I'm going to do is I'm going to be hosting a webinar that's going to be 3 or 4 webinars this next week for the 7 to 10 people that didn't go to the in-person meeting. And so I loved seeing what Kentucky was doing, listening to New Mexico. It all looks great. Keep going, keep doing the good work, and we'll all see each other in January.
Thank you for that update. Kentucky did a great job of presenting today, and I believe Morgan stepped off, but I'll just open it up for a second if there's anybody else from Kentucky that wants to say anything.
It's Chad from Kentucky.
Hi,
I
Chad.
would like to ask, Morgan, during her thing was going through, and she was initially was emailing service directors. A lot of our service directors, are busy, have multiple different roles. So sometimes it's hard to get a response back from them. And what she had done is we have a pediatric abusive head trauma coordinators or teachers, instructors, if you would, that, are teaching pediatric abusive head trauma around the state. Well, she emailed us, and that was my first knowledge of the whole program is when she sent the email out, and I was like, hey, I went to my boss and said, hey, let's look into this. Let's see what it's about. And it kind of took it off of our directors and getting it on to somebody else. And I think that's where a lot of our people get interested at the last minute come from, was emailing those people and getting it off the director's hands. And sometimes in Kentucky we do have a problem with some directors wanting to have control over everything. And putting this off to somebody else, they think the director, they're not going to have a say-so, whereas they would still have to have that approval through them before they've done anything. But getting everybody to understand that, because there is various grants that we've had over the years through EMSC that she could provide equipment for services around the state that needed it, and she would get no response for it. And it's like, they wasn't realizing the thousands of dollars they could be missing out on as far as pediatric equipment because they wouldn't respond. But she's done a real good job of recruiting everybody else and getting it to everybody besides the directors to try to get it off of their plate.
I think that was a wonderful perspective on sort of some organizational theory there. This concept of bottom up and top down. But even if you go bottom up, you still got to let the top know. So thank you for that comment. I do want to hear more about what the abusive head injury program was. So is that another EMSC program? Is that another statewide initiative? Because this concept of leveraging existing networks of individuals, I think it really is brilliant and makes a lot of sense. But what can you just tell us more about what the pediatric abusive head injury, is that something at the state level, at the EMSC level, completely separate from EMSC?
It's required through the state. I can't remember the exact date, but I know the one that stands out is every EMS professional, nursing staff, daycares, doctors, I don't think doctors are required. Dr. Ballard, if she's on still, might be able to elaborate more on that. But basically, anybody in the healthcare or anybody involved with children, as far as daycares or healthcare workers, are required to have this pediatric abusive head trauma class. And it was set in. Everybody had to have it by 2015. I think it started in 10 or 13 is when they initially started teaching them. And it's basically a way for the people to pick up on abusive head trauma in pediatric patients because so many cases was being missed. And Kentucky ranked real high in the nation initially when they started this. It was through a doctor at Cozairs and Dr. Fallett. I can't remember the lady's name, but Dr. Fallett might be able to remember that doctor's name. But
yes.
basically,
Melissa Curry is the physician she's a forensics physician, and she has developed the training, and physicians were also required to do it as well as new parents. So before a baby can be discharged from the hospital as a newborn, the parents have to also have some education about child's maltreatment, abuse, shaken baby syndrome, the hazards of shaking the baby. All of this is formal education and is required by statute because of the high number of deaths that we were experiencing in our state due to child abuse.
Thank you so much for sharing that. So whether or not it's specifically that type of program, which other states don't have, I think it's just highlighting leveraging existing infrastructure and getting enthusiastic people, because that's a really neat story, not necessarily something that would come to my mind of going to that type of program, but a statewide program that had different individuals across the state. So really great work on that. Excellent. I'll go back to Cassidy now. Thank you guys so much for your interactivity and collaboration today.
Yes, absolutely. Thank you. We have about 2 minutes remaining, so just be respectful of everybody's time. I'll just call on the remaining states, and if you could just give me your quick one for the day, that would be fantastic. So, Ohio.
Hi, this is Joe. I liked hearing from all the states that it sounds like at least our ideas are similar to what they're doing. I think our issue now is simply implementation. We really are just now starting on the follow up on the list from the survey to verify who said yes that actually has a PEC. So we may be about a half a step behind where some of the other folks are now, but we're pushing that forward, and hopefully we'll be able to get some of that done so that we have some more a list, a more robust list of PECs to be able to hopefully draw some experience from. One of the things we're working on is an online forum for PECs. Once we get folks listed as that will offer to them to be able to compare best practices with each other, bounce ideas off each other, that type of thing, and hopefully then as the list gets more robust, the conversation gets better. Thank you.
Thank you for that. How about Pennsylvania?
I'm sorry. This is Terry. I'm sorry to interject, but Cassidy actually has to come off at 12:30. But I can stay on if the rest of you can and would like to continue to finish up this conversation. So I'm sorry. Go ahead.
Oh, thank you. Just a quick update. So we have Pennsylvania, and who else do we have left? I think we're getting close to the end here.
We have Pennsylvania, Montana, New Mexico presented, and then Wisconsin.
Okay. So Pennsylvania, Montana, and Montana. So, okay, excellent. If we can just hear from those three states, and then I think we'll wrap up. I just want to be sensitive to everyone's time. So thank you, Cassidy. Thank you, Terry.
This is Jason from Wisconsin. I'll just echo after I presented that stuff before that. Just interesting to see that we're all over the U.S. and having the same similar project barriers and successes. And I really appreciate everybody's candid discussions on what's working and what's not working in their area. And I'm looking forward to continuing on with this project.
Thank you. And do we have anyone from Montana or Pennsylvania?
Jason's here from Montana.
Excellent.
The takeaway I have from today really is around some sort of carrot that'll bring those difficult to engage agencies to the table. During some of the previous surveys, the NEDARC survey and things like that, Montana offered some pediatric equipment to those agencies that participated, and I'm beginning to hear more and more that really was appreciated and really got folks' attention. So we may have to move some funds from our travel budget, which is looking like it was a little higher than we needed, into a budget that we can use for some sort of carrot that'll bring folks to the table, get their attention, and I hate to say buy engagement, but to a good degree that may be what it is. So we'll be looking into that in the next few weeks, I believe.
Thank you. And I think we'll end there. And registration for the Austin workshop, you can go ahead and still do that. Please, begin working on your storyboards and be in touch with our team if you have any questions about that. We're happy to respond to emails, and contacts with EMS agencies that currently report having an individual who is responsible for coordinating pediatric-specific activities were due December 21st. But as we've heard from many states, what they wrote on the survey may be different than what is actually currently going on. So I think that's a common thread that we've heard. So thank you guys so much. If there's any other comments, please just type them in the chat box and give us an email. And again, thank you to our 3 states for presenting. And we really appreciate any feedback. If you think this is working, we'll do it again. If people feel that a better approach would be something else, let us know, and we'll have our own PDSA cycle here and adapt accordingly. Have a great holiday. For those who are celebrating Christmas, for those who celebrate other holidays, happy holiday season, and we'll talk to you all soon, okay?
Thank you.
Thank you.
Thanks, everyone.